pioneers in medicine get the recognition they deserve in spite of great discoveries and innovations. This project will tell you about two such pioneers. In the 1800s, disease was thought to be caused by miasma, bad air. If the air smelled bad, disease would result. Puerperal fever was the primary cause of death for women giving birth in maternity wards. Alexander Gordon and Oliver Wendell Holmes Sr. are credited with discovering that the fever spread by human contact, but the medical community rejected the idea. Ignaz Semmelweis made similar findings in Vienna in the mid-1800s. In his hospital, 600 to 800 women per year died on the maternity ward run by doctors compared to 60 per year on the ward run by midwives. Women who gave birth at home had the highest survival rate. The problem was that doctors would perform autopsies in one area of the hospital and then go directly without washing to the maternity ward to treat women. Semmelweis realized what was happening. He soon required all doctors treating women to wash their hands in a solution of chlorinated lime after performing autopsies. They had to wash with soap in between patient visits. The fatality rate from infections decreased from 18% to 1% in that year alone, saving the lives of 350 women. Some doctors followed up on his work, but most rejected it. Gentlemen did not cause disease. Semmelweis went insane trying to convince the medical community to follow his method and thus save the lives of women. Moving forward in time to World War II, we meet Archibald McHindoo, a plastic surgeon. The increase in aircraft use in World War II meant more pilot casualties, especially burns, since the planes carried large amounts of fuel. McHindoo was a New Zealander who worked in England on burn victims using new techniques on the pilots from the Battle of Britain. The pilots he treated were known as the Guinea Pig Club due to the experimental nature of his work. The victims were burned so badly in the face that they were unrecognizable, having lost ears, noses, or eyelids. Many had hands and feet nearly burned off. McHindoo noticed that the patients that had landed in the Atlantic Ocean had cleaner wounds than those that had landed elsewhere, making skin grafting easier. He created the successful use of the saline bath to recreate those saltwater conditions. The burn bath is still in use today. McHindoo also realized the psychological effects of the serious disfigurement that the burns caused and treated that issue by fostering a sense of camaraderie among the patients. One patient described the ward, "It resembled a big comfortable hotel. It was mad. Everybody was doing their own thing. There was a big barrel of beer at the end of the ward and you could help yourself." McHindoo arranged to have members of the city have the patients over as guests so that they could get used to being outside of the comfortable cocoon of the hospital ward. Members of the Guinea Pig Club continued to have reunions well after the war ended. McHindoo went on to a lucrative career in plastic surgery, having such famous patients as Ava Gardner, the Duchess of Windsor, and the granddaughter of Queen Victoria. War brings disease and injury. Disease and injury bring a desire to the medical community to cure and improve treatment. World Wars I and II had, out of necessity, sparked the innovations needed to assist the soldiers in protecting their countries. Today, medical patients continue. Burns and amputations from roadside bombs are the trench fever and typhus of today. Companies are developing artificial limbs that allow a person to compete in triathlons and Ironman competitions. It appears the focus for ongoing military medicine is in the engineering field and technological field as much as the medical and scientific.